Cardiac magnetic resonance, or CMR, is important in the evaluation for potential thrombus because CMR can provide a definitive diagnosis of the etiology of a cardiac mass. CMR has advantages over other modalities such as echocardiography, as CMR can provide multi-sequence detailed characterization of soft tissue masses, where echo offers primarily visualization and size measurements.
Prior to the MRI, the patients are screened for metal or implanted devices that may be contraindicated. If gadolinium is to be given, they are screened for allergies and renal function to ensure adequate safety. Cardiac MRI imaging faces several challenges. For optimal imaging, patients need to hold their breath. Sometimes patients with shortness of breath have difficulty accomplishing this task. The EKG is also used for imaging, and patients with cardiac arrhythmias may disrupt the gating. Parameters need to be adjusted to accomplish this goal.
Demonstrating the cardiac MRI exam with me will be Deb Brannon, our lead MRI technologist, and Chad Woodhouse, a cardiac MRI technologist.
Before beginning the acquisition, provide the patient with headphones connected to the technologist microphone so that commands can be efficiently communicated, and place electrocardiogram leads in the optimal positions on the left chest.
After confirming adequate EKG signal, the patient's position is confirmed on the scan table and an appropriately sized surface coil for maximizing signal-to-noise ratio is placed over the heart.
Inform the patient to breathe when instructed during the imaging by holding breath at the end of expiration. Imaging reproducibility.